Ariel, you want to talk about our
when you
timeline?
make this decision.
Yeah, so thank you all for coming in and speaking to us today. We only have a few minutes left.
No.
I wanted to
I did.
just direct the task force just for a couple of quick minutes to the CCO survey. We did this a couple of years ago with the backline implementation, so we're kind of thinking about doing the same type of thing. Are you going to implement acupuncture or kind of behavioral therapy, et cetera? How are you going to change that? Are you going to implement any prescription controls? How are you going to do that? That type of thing. And we're also going to ask if they have any feedback or responses or learning from implementing all of the backline things that could help inform us moving forward. Are there any specific questions that you think we should ask the CCOs? You got, I believe in your packet there was sort of a rough, what we've kind of put together as a rough draft of the survey.
Can I just add something? I think one of the things that we've learned in terms of the back pain implementation, because we implemented kind of this policy for back pain 2 years ago. So this policy was implemented by HERC for back pain 2 years ago. And I think that what we have learned is that it is very clearly not a black and white policy. And what we learned from this, the prior CCO implementation survey is that there were elements of the guideline that they planned to implement. There was individual decision making that they planned to do and are continuing to do. And so part of what we're hoping with this survey is understanding what are the elements that would help them in terms of allowing for this individualized decision making, which they are doing and plan to continue to do. And so really kind of understanding that, because this is not, it looks like a black and white policy, and I think that that's a lot of what we've heard from the public, but it's not, and it's not implemented in that way. And so we are hoping that the survey will help us to kind of clarify what are the elements of how we describe this policy that helps just with that individualized decision-making and medical review that's going on.
Where's the survey from chronic pain patients?
Another comment on that. The other problem with the back pain when they instituted those is they were so reactionary. It was quite upsetting to see how those were implemented. So I would encourage the CCOs to actually look at things and start reaching out and having discussions early on, because this is not a black and white policy. What we saw with the chronic back pain guidelines is this fact that people knew in advance, but medical systems are so reactionary, all of a sudden patients were just getting a letter saying we're not going to prescribe anymore, without any context, without anything else in there, and that was extremely distressful, to say the least, I think, for everybody involved. So I would hope that there's more discussion going up front. We haven't voted on anything, or actually I don't think we voted, really. No. So this hasn't been implemented, but anything, communication, as I think we have seen today, is extraordinarily appropriate and important.
Thank you.
And I've been just absolutely impressed with all of you. Thank you so much for coming in and providing your stories and perspectives and doing it in such a respectful manner. I really appreciate that.
Thank you.
Thank you for answering questions.
Yeah, am I on? Yeah. Okay. So I think it's important to have some kind of question around the referral process and prior authorization process. Utilization management has been a big barrier for patients being able to access some of the physical modalities. It's a little complicated with the 30 combined visits covering different physical modalities. How does that get distributed? What we're seeing is that patients have a very long referral process or a very long prior authorization process, so it takes a long time to be able to get into that first visit for chiropractic or acupuncture, physical therapy. So something consistent among the CCOs, some ways of making sure that there aren't those added barriers, especially when there's a perception by patients that so much is already being taken away. We want to make sure that we're really adding services.
Because one of the priorities of the Oregon State Pain Commission is to help our community change the conversation about pain so that we all understand better how pain works and how we can work together to create an effective treatment plan. I'd like to know from the CCOs what the different organizations have done to promote better understanding of pain among clinicians and how what outcomes there have been from that in terms of patient-clinician interaction, and maybe also feedback from their patients about the same thing.
I just want
I just wanted to add and piggyback on what Laura said. As a cognitive behavioral therapist, I often only get to see the patients from the CCOs one time. For some reason, there's some sort of loophole. And so some CCOs may give an exception and may give 4 sessions. So the pain experts who do CBT, we should be able to see patients so we can help change some of the other things that can be helpful.
Any other feedback on the CCO survey? Then with that, I apologize for taking up a little bit more of your time than we had asked already. But I think the sort of important part that staff wants is what direction do you want us to go in? You've heard we're doing a couple of things we've already kind of moved forward with. We're working with the Evidence-Based Policy Center, with the Pharmacy and Therapeutics Committee. We're going to do the CCO survey. What other information do you want us to get? What direction do you want us to take, if any, in revising the policy and bringing it back to you in December? What specifically can we do to move this forward?